Welcome to Edge Productions. Today I wanted to share with you some of the first aid supplies that we have gathered throughout the years. The other day we were at the eye doctor and there were signs all over the office that said short-staffed is the new pandemic, which had me thinking about our supplies and what we have and maybe kind of increasing those supplies to maybe be a little bit more self-sufficient for first aid and things like that if something were to happen. Now, I am a professional registered nurse, and just please take the information I give you not as your own medical advice. I just am sharing some thoughts and knowledge with you, but if you have direct medical questions, you should consult your physician. Uh, so getting started, I'll talk about some of the books that we have. And one is, this is put out by DEMA, which is the Delaware Emergency Management Agency. And there's those kind of agencies in all of your states. But this came from the Delaware Citizens Corps, and I believe this was a book that they gave us for the CERT program. So that program, we can talk a little bit more about that. This video is going to be mainly focused on first aid and not really get into disaster stuff, but we may save that for another video. Another book is a drug guide. I have this because of nursing. However, it is a little bit outdated. It's been a while since I've been into, went to nursing school, obviously, but either way, it has a lot of helpful information about medication and dosages. It just may not have some of the newer type medications that have come out or any kind of changes. Other book is a Taber's medical dictionary. This was something I also used in nursing school, but any kind of medical dictionary might be helpful. It has all kinds of different things in here, different kinds of medical issues, and there's some pictures, so that could be helpful. I'm sure you can get these online. Another book that we have is the Survival Medicine Handbook. This book was an inspiration to us from the Canadian Prepper, who has a YouTube channel as well, and he recommended this book. He sells it on his website. However, I believe that they are sold out, and they were selling out pretty quick on Amazon, but there was still some left when I ordered. This was written by a medical physician and I believe a nurse practitioner, and it also has pictures and talks about different issues. And again, the title is The Essential Guide for When Help is Not on the Way. So another medical guide for being a little bit self-sufficient. We have gathered a lot of stuff in this big bag here. This bag I was able to get off Marketplace. It was barely used. It wasn't used for medical, and they're also online too. So we'll get into that bag. Wanted to show you a couple things from the table though before we do. One is a fire blanket. Again, not so much on disaster stuff, but this is just a helpful tip I wanted to throw in, that you can order these. These could be helpful in a fire emergency. One thing that we read for review was not to open these up and check them. Just kind of trust that they are ready to roll if you need it. Apparently there's a bunch of little fibers in there and stuff that will fall out and make a mess. The other things, I have a couple little first aid kits. So a lot of times these first aid kits, you get them at different events and stuff, and they just have band-aids and some alcohol cleansers and things like that in them, which can be helpful if you get a cut or something and you want to try to clean it the best you can. You can't wash your hands or can't wash it. That is helpful, and the band-aid to cover it up and protect it. And this was another type of mini first aid kits, which can be helpful to have handy in your vehicles and things like that. This one has some tweezers that they work sometimes for taking ticks off and stuff if you're in the woods. Pine cone. Come on, we're off pine cones. We hear pine cones are not good for dogs.
Pine cone. Pine cone.
So we're in pine cone rehab.
Pine cone. But we're in pine cone heaven. There's everywhere.
I know.
There's actual pine tree here. Look.
It's hard to be in Pinecone Rehab when there's dealers all over the place. Come on. Come on, Pinecone. So a few other things, safety goggles are helpful. If you're in a situation where somebody's throwing up or having some kind of fluids or bodily fluids leaking and you don't want to get them in your eyes, that's going to be helpful if you're treating them or cleaning a wound up or something like that. That's going to keep you from hurting your eyes, if anything. There's masks. Of course, we're all familiar with masks by now, but before the pandemic even, we had some masks for ourselves to keep us safe. So I'm sure everybody has that covered at some point by now. So these are helpful to exercise your lungs. It just helps the expansion of them, and the goal here is to raise, well, it comes with instructions, but to raise these balls to a certain point. It's not always to get them up to the top quickly right away, but to hold them at certain levels, and it's a slow exercise. So these are helpful. This is just one small one, but could be helpful if somebody is having breathing issues to just do some lung exercises. Another thing we ordered was a mini nebulizer. So this works really good. I tried it. It's that mist, and you can hold it, and if your doctor is to prescribe you, actual medication for breathing to put in there, it's handheld and you can take it anywhere. I thought it was a decent purchase. If you don't want to use the mask, there is just a little mouthpiece there, and there's a child-sized piece too. So you have those, and that comes in a little bag, and that's handy. So a couple other things before we get into the bag is a pulse ox reader. So this just will give you your heart rate and your oxygen percent that's in your blood. There's these in usually in any pharmacy, and you can get them online. You put your finger in here and it gives you a reading. One thing that you want to do is to find out what your baselines are. That's going to be important. When you're normal, not and feeling well, what is your readings? What's your heart rate normally run? I can tell you that your heart rate should be between 60 and 100 beats per minute. But if I'm normally 60 and all of a sudden my heart rate's 90, that's a significant jump than what my normal baseline is. My oxygen is usually around 98, 99. So while your oxygen level should be 90 or above, I'm usually 98 or 99. So if I'm 92, maybe there's a reason for that big change if I'm normally 98 or 99. So those are helpful to keep an eye on things and to gather your baseline. The other thing is a thermometer. Of course, we've gotten real familiar with these with the pandemic, but you should have one of these. Know what your baseline temperature is. 98.6 should be normal temperature. However, somebody might run 97, and to them maybe 98.9 they feel sick, or maybe 98.7 they feel sick because they're it's a little hot for them. So it's all about knowing what your own personal baseline is and going from there. So I also have a stethoscope. I have a couple of those. We'll talk about that, but the main thing is, if you don't know how to use one, you certainly could get familiar with it, but I would say get familiar with it so that you know how to use it, because in a panic situation, you don't want to try to learn at that time. You want to know before that. The other thing is that we've recently gotten was a dosimeter. This is a radiation level reader. It reads levels of radiation per hour, I believe, and then accumulated radiation levels over time. And if you go online, you can see what the limits are, what they should be per hour, and how much radiation should be healthy for the average person per year to be exposed to. This one's by Mira, so they do have different kinds out there, and with all that's going on in the world right now, there's not many stock left. So it's given me a reading of 0.06, 05, 04. So which, according to when I looked it up, was okay. But interesting to know that there are levels of radiation all around us. You think that there wouldn't be any unless there's a reason for it, but it's in the air. It's just a matter of what is acceptable levels for us to live with. I also am a real estate agent, so in doing real estate inspections, we test for radon gas, which is radioactive gas that can come from the ground. And whenever they test radon levels, I've been told that they need to have that tester away from cell phones and things like that because it'll cause false readings. So that kind of is telling that some of our phones and electronic devices have a level of radiation that they emit as well. But okay, a couple of things that we have kind of in bulk, and they're actually in this as well. These are little sodium chloride solution. They're in these little individual dosage containers, and you can separate them out, and they're helpful for a lot of things. One, they're single dose for cleaning a wound. You can squeeze it and it'll give a nice bit of pressure. If you have something in your eye, you could use it to get that out of your eye, but mainly for cleaning, getting it out of your eye. This is also something to put in. It's sodium chloride, so you could put it in here to help give a mist and to give a little bit of moisture for breathing. So lots of different uses, and I did get a box of these. Mainly, I like using them for a quick wound cleaner for smaller wounds. Then I have a box of just sterile gauze pads. So those are always helpful for cleaning wounds or cleaning anything. Wound dressings, they definitely can be helpful. And a box of gloves. So we all know about the gloves from the pandemic and how helpful they can be. One thing that we realized when we were getting all of our stuff together is I have this blood pressure cuff, and these lines have melted or worn out from the position that they were in for so long and not being used, and broke. So this is completely broke, and we're gonna have to order a new one. So you always want to check your supply, check the dates on things that you have, and see what maybe you need to get new again. But we do have a list of a couple things. That blood pressure cuff, there's a couple other ideas that we had of things that we wanted to do. So we'll get into that. Here's another stethoscope I put in here. I'm not sure what I'm gonna put in this part of the bag yet, but they do come off. So that's nice. Perhaps you could put something in there. Perhaps you could put something in there that would be easy to just grab if you needed that one section for something. Okay. There's two side pockets. So in this side pocket, I've kind of dedicated to blood loss. And in here is two combat application tourniquets. And it's CAT tourniquets. These you can get right offline. They're very nice tourniquets, and I would recommend investing in one or two of these. This can be a complete lifesaver to stop bleeding. One thing you need to do is know how to use it, or it can't help you at all. And knowing how to use it before a situation so that you're not trying to learn during a panic. Okay, so we have a couple of these. I have a styptic pencil, which is supposed to stop bleeding. I don't know how effective these really are, but it's in there. I have a quick clot gauze that has has medication in it to stop bleeding right in the gauze. So that's helpful. It's only 2 feet of it, so not a whole lot of it. I might get a couple more of these, but that seems to me like it would be helpful. I also have a skin stapler. So one thing about wounds, be careful closing some wounds up. Make sure that you get it real clean. One thing you don't want to do is when you close a wound up is trap infection in there. So there's a certain way to do things, and I would suggest that you educate yourself on how to do that. But a skin stapler could definitely be helpful. So that is what is in that side. This side, all the recent threats of radiation and nuclear war, we have potassium iodide. You should look that up, get familiar with it, and know why that might be important. It protects the thyroid gland against radiation exposure and developing cancer in that area. It helps, not to say that it's 100%. There's also a certain time to take it to make it effective. So I think you have to try to take it at least 30 minutes before an exposure. So that's why you should have some on hand in case you need it. Not to mention, not even nuclear war. I know people that live near nuclear power plants, most of them have some kind of kit of potassium iodide in case there's an issue. The other thing we just recently ordered that I give credit again to Canadian Prepper on YouTube is this from Jase Medical. I can put the link in the description below. But Jase Medical is doctors that have created this preparedness medication kit. Okay, there's this little guide in here that tells you what to use what for, but you can order. They have doctors that issue these medications to you. So when you order them, they can do a telehealth conference if needed, if you have medical conditions or concerns about the medications or have allergies and things like that. But they will set you up with the kits, and I thought it was a really great idea. And they give you this emergency antibiotic guide. Mostly it is antibiotics, and you have all of them in here to kind of cover a lot of different issues. One thing that we were going to do is label them on the top so that it's easy to identify them and grab them in a quick hurry and use them. So I will put that link, but it's Jase Medical, and it's for Canada and US that you can order that. Very helpful, I thought. The front part of this I've converted to like a mini first aid kit, which is kind of what everything was already in our other first aid kit before we started buying more supplies. I put all that in the front. Lots of Band-Aids. There's something called Steri strips, which can sometimes take the place of stitches, depending on the type of cut or wound, but they can be helpful. There are Vaseline gauze in here, which they can be helpful with healing, and it makes the dressing a non-stick dressing. Sterile gauze, again, more gauze, bigger gauze. This is something called an ABD pad, which if you have a lot of bleeding, it'll absorb that. There's some scissors, so you want to make sure you have a good pair of scissors, or two. There's actually a couple pair in here. There's more tweezers, a light. This is good to look in ears and up noses and in mouths. Some tissues, more alcohol swabs, a cold pack, more of these sterile saline solution things here that can be wound cleanser. This was part of one of my kits before, but it has one of these little kits here: insect sting relief, ammonia inhalant pad, iodine pads. I thought those were a nice variety of things there. Another pencil, triple antibiotic ointment, and little single-use packs of different creams, first aid cream, some more first aid creams, some Benadryl. So as long as the person doesn't have an allergy to antihistamines or Benadryl, the generic version, so it's not really Benadryl, but that medication can help with allergies if somebody's having an allergic reaction to something. If they're having a severe allergic reaction to something, this is a tablet that goes to your stomach, so it's not going to help as quickly. But minor allergic reactions, and also it helps with motion sickness, it helps with nausea. It has a lot of benefits. So I would suggest looking that up and deciding if that's something that you might want to have in your kit. Something for eye drops, if somebody has something in their eye and they need, or maybe their eyes are dry, they need lubrication. Depressors are always helpful for making a splint. If somebody broke their finger, you know, looking into things, something like that, always helpful. And some tape. So we have tape, lots of tape, all that kind of stuff in there. This is a first aid guide, so it's supposed to mean if you put it on head injury, it tells you the symptoms and the treatment down here. So it's a neat little roll guide for different things. All right, we will zip this up. Other things, this is a pill cutter. That might be helpful to you just to have one, so you're not trying to cut a pill in half. Sometimes they can be hard to cut in half. So this is usually, I think I picked this up for free somewhere, and helpful. The other thing is having a notepad. Documentation is important if somebody is ill and managing their symptoms, and if they're getting better or worse. If you have good documentation, you'll be able to know that. You won't have to second guess or remember. Another scissors and an emergency blanket. So that can be helpful to keep warm. Inside I have another full pack of steri strips. We talked about them a few minutes ago, and they help close the skin in certain different wounds, and they are called steri strips. This is a non-adherent pad. Anytime you do any kind of wound care, a non-adherent pad, nothing is worse than wrapping somebody up in some gauze that ends up sticking to the wound when it's time to change the bandage. And the non-adherent pads should not stick. Another tip on that is when you have these and you're pulling off a dirty dressing to change it out for a clean one, you can try to put some saline on it to loosen it up a little bit. But these non-adherent pads would go on every wound I ever dressed, so that it didn't stick when it was time to come off. That can be painful to that person. The other thing is a bottle of peroxide. So that is in here. This is a thicker type of roll bandage or roll gauze, and you can put that around a wound and wrap that up. That's always helpful. And a whole box of surgical tape. So that has many uses too. Of course, tape has many uses. The other thing is I have quite a few bags of roll gauze that is smaller than this bigger kind. So this would be for something bigger, and this is a smaller type of wrap that if you needed to wrap a wound, or I don't do much for band-aids. I think that band-aids do have their place and can be helpful, but I'm big on cleaning any kind of wound and putting a non-adherent dressing over it, some first aid cream or whatever it calls for, and wrapping it. I just think that it helps it stay drier, helps the germs stay away from it more. I just like this version better. The other thing we have in here is a couple bottles of Silvadene gel. So it's an antimicrobial skin and wound gel, and it's silver. And silver has a lot of helpful components to it when it comes to wound care. Other thing it helps for is burns. So it'll help if somebody gets a burn, you can put some Silvadene on it, clean it, put some Silvadene on it, wrap it up. This will help with healing, help keep it from getting infected, and helps with pain. So this is just a really great, great topical medication to have on hand. And I got some from Canadian Prepper's website, and some from Amazon, I believe. But we have quite a few of those. The other thing we have is triple antibiotic ointment. Some people might say that it might not be necessary to use, but it is first aid antibiotic ointment. It is helpful. One thing, because it's a gel and it's jelly, I think it helps stop bleeding sometimes too. Not if something's bleeding profusely, of course, but you know, some kind of small wound and you put that on, it's kind of has a packing sense to it. But peace of mind, maybe, if it doesn't help with infection, I don't know. I think the best thing to help with infection is keeping the wound cleaned. But this would give me peace of mind too. The other thing is I have a bunch of Vaseline gauze, which is petroleum gauze strips. Also has great healing, and it also it makes it non-stick. So it keeps that wound from drying out if you have a certain type of wound that you don't want to get dried out, that you need to keep clean and keep it from getting infected and drying out and scabbing over and all of that kind of thing. So this is something that can be very helpful. My favorite go-to, it depends on the wound, and I think some of these books would help with that, but if there was a kind of a nasty cut, I would go for cleaning it really good, wiping it off with gauze, putting one of these on a non-adherent pad and wrapping it up in the roll gauze. This could also help it heal a little bit better. So that is where we are for now. I think that we have a great start. I wouldn't say that we're ready for everything, but we could cover some things, and hopefully maybe none of this stuff is ever needed, but I feel like we could handle most things if we needed to. Just keeping in mind that short-staffed is the new pandemic, and I'm sure people have seen that where they go, and it's also in our medical facilities as well, being short-staffed. And just one more thing about this, speaks more on disaster preparedness, which is something called CERT. So CERT is a program that should be, you should have a local CERT chapter in your area. So it's across the US. I don't know if it's in any other countries, but it's from Emergency Management. And when you attend CERT training, they put on training for citizens, and it stands for Community Emergency Response Team. And what that means is, they say that when something happens, whoever is there is the first responder until the other first responders get there. So it's kind of teaches you how to react to certain things that could come up, whether it be a car accident that you see and you're able to help before emergency services get there, how to react to that and how to respond to that. So there's I believe in Delaware we have a 2-day class, and then they build on classes and have more classes for things and more training. But they give you a complete book and guide, and they do some hands-on training, which is really neat. You also get a nice backpack to put stuff in and to keep in your car and be ready. I think there's a hard hat in here, some tools, some gloves, just some things that could be helpful if something happened and you were there. Again, you're going to want to keep a notebook to document things. So, but that completes everything that we have. Hopefully it was helpful to you. If there is anything that you think we should add to our collection, please feel free to comment below. We're going to do a couple more videos like this of some recent things that we have purchased. And the other thing, I just wanted to remind you about the JASE, G-A-S-E Medical, which has the emergency antibiotic kit that you can buy. I'll put that link below. But just kind of think about where your skill level is and what kind of things you might be able to have around the house to keep you safe and to kind of be a little bit more self-sufficient. So thank you. Hopefully you can like and subscribe to our channel, and we'll see you in the next video.